Bipolar disorder and co-occurring mental health conditions. People diagnosed with bipolar disorder often experience other mental health challenges alongside their primary condition. This is not uncommon. Research suggests that a majority of individuals with bipolar disorder will also meet the criteria for at least one additional mental health disorder during their lifetime. Understanding these co-occurring conditions is critical because they can complicate treatment and significantly affect a person's overall well-being. The link between bipolar disorder and anxiety disorders are the most frequent co-occurring condition, affecting roughly 40% of those with bipolar disorder. This overlap isn't simply coincidence. Symptoms can worsen each other. For example, a manic episode can intensify anxiety, while anxiety itself can trigger or exacerbate mood swings in bipolar disorder. Difficulty sleeping, a common symptom of anxiety, can also destabilize mood regulation in bipolar disorder, pushing people toward more extreme highs or lows. The overlap with borderline personality disorder, BPD, is another frequent comorbidity. The conditions share symptoms like emotional instability, impulsivity, and intense mood swings, leading to frequent misdiagnoses. Up to 40% of people initially diagnosed with BPD may actually have bipolar disorder, while about 10–20% of people with bipolar disorder also meet the criteria for BPD. The key difference lies in the duration and nature of mood shifts. Bipolar disorder involves distinct episodes, while BPD's emotional fluctuations are often more rapid and pervasive. ADHD and bipolar disorder. A complex relationship, attention deficit hyperactivity disorder, ADHD, also often co-occurs with bipolar disorder, affecting as many as 17% of adults with the condition. The combination can lead to poorer functioning and more frequent rapid cycling episodes. The overlap in symptoms, such as impulsivity and irritability, makes differentiation challenging. High energy levels, disorganized thinking, and poor planning in untreated ADHD can mimic mania, further complicating diagnosis. Additionally, depression is common in ADHD, affecting 18.653% of those diagnosed, which can obscure the true nature of the bipolar disorder. Why co-occurring disorders matter. Treating only one condition while ignoring others is ineffective. Research shows that having both bipolar disorder and ADHD, for instance, worsens outcomes for both conditions. Accurate diagnosis and comprehensive treatment are essential for improving quality of life. If symptoms don't align with the bipolar diagnosis, a thorough evaluation for co-occurring disorders is crucial. Ignoring these connections can lead to prolonged suffering and suboptimal treatment. Mental health professionals must consider the full picture to provide the most effective care. Ultimately, many people with bipolar disorder live with multiple mental health conditions. Recognizing and addressing these comorbidities is vital for a more accurate diagnosis and a path toward better well-being.